Bismillah ar-Rahman ar-Rahim. Welcome to my channel Science of Life with Dr. Muhammad Yousaf. Today I am going to start the cardiovascular system, in which we will first discuss the properties of cardiac muscle. But as my routine, one ayah from Holy Quran and then we will proceed. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم يا أيها الذين آمنوا ادخلوا في السلم كافة ولا تتبعوا خطوات الشيطان إنه لكم عدو مبين ऐ ईमान वालो है मोमिनो उदखुलू फिस्सिल्म काफ़ा इस्लाम में पूरे के पूरे दाखिल हो जाओ वला तत्तबिउ खुतवात शैतान और शैतान के नक्शे कदम की पैरवी मत करो इन्नहु लकुम अदुव्वुम मुबीन वो तुम्हारा बहुत खुला वाज़े दुश्मन है। तो अल्लाह पाक फरमा रहे हैं कि दीन में पूरे के पूरे दाखिल हो जाओ। दीन पूरे का पूरा हमने इख्तियार करना है। शैतान हमें इस पर नहीं चलने देगा। शैतान ने तो उस पैदाइश के वक्त इंसान की उस तारीख़ के वक्त आदम अलैहिस्सलाम की जन्नत से निकाले जाने के वक्त इसको शैतान को दुत्कारा जाने के वक्त उसने कहा था कि मैं इनको बहकाऊंगा, तेरे रास्ते से हटाऊंगा। तो शैतान हमारा खुला दुश्मन है। शैतान के अंदर तो पूरे का पूरा दीन मेरे लिए है। तो अगर उसमें कोई गलती रह जाए तो उसके लिए माफ़ी है। अल्लाह पाक समझ अमल की तौफीक दे। So we are going to talk about the properties of cardiac muscle, which is the part of this cardiovascular system. Cardiovascular system as comprises of heart and blood vessels through which circulation takes place. So heart, blood vessels through which the blood is circulation takes place. So we will discuss the properties of cardiac muscle, then we will shift to circulation itself. This is a rough idea of this, how this is heart, and the different systems of the blood vessels. That is, this is the arterial system, aorta, which is taking the blood to whole of the body, and then the pulmonary artery is taking the blood to the lungs, and the blood is returning back to the heart through the veins from the lungs, pulmonary veins. We will see in circulation. So this is the rough. So heart and blood vessel system, and this circulation idea of this circulation, the circulatory system is this heart itself. We will see it. Circulation is a two-circuit circulation which are connected in series. Series mean what? One pump is pumping the blood into the lungs, and blood brought back to the second pump, and it pumps the blood through the whole of the body, and blood is brought back to the first pump again. So two pumps connected in series. That is, right atrium is receiving the blood from whole of the venous system of the body, and the blood is pumped into the right, goes to the right ventricle, then it is pumped to the lungs where it is oxygenated, and it is brought back to the second pump, that is left atrium and left ventricle. This is the second pump, and it is the pumping the blood to the whole of the body, and it is returning back to the first pump. So two pumps connected in series. So that is the arrangement of this circulatory system. So we will discuss first this heart. This diagram, just to, you should remember when we discuss the ECG, when we discuss the heart sounds as well, the arrangement of the position, anatomical position of the heart in the chest. This is heart, and whole of this is left ventricle. As you know, the heart comprises of four chambers, two atria, two ventricle. This is the left ventricle, and the right ventricle is this is all almost front of is the left ventricle, some part of the right ventricle as well. This is arranged like that, and there are two atria here, and the septum lies somewhere here, like this. So we will see conduction of the nerve impulse will occur from atria to ventricle, this, and we will detect the sounds, aortic valve and pulmonary valve, and the two valves in the AV valves. We will see this is the anatomical position of the heart in between lungs. This is the aorta, and this is the base of the pulmonary trunk. So heart we are going to discuss. Main purpose of today's lecture is the properties of the cardiac muscle. Heart, this is the rough diagram of the heart. It is covered by a pericardium, which comprises of two layers. One is the visceral layer and the outer fibrous coat and inner visceral layer. In between these two layers, there is a fluid, pericardial fluid. It is lubrication. When the heart is contracting, the sliding movement of the two membrane, the pericardial covering takes place, and so this is lubrication. So pericardium. This is pericardium. Then myocardium, the muscle, the properties of which we are going to discuss. And then the inner lining of the heart is known as endocardium, which is lining the cavities, and it is also covering the valves. So we will see the valves when we discuss the valves and the heart sound discuss करेंगे. So this is ventricle. Internal lining of the ventricle is the endometrium. Internal lining of the atria as well, that is the endocardium. Now the myocardium we are going to talk about. Muscles की property हम देखेंगे. Myocardium, there are atrial muscles. Atrial muscles, detailed anatomy you will study in your anatomy classes. So the atrial muscles are arranged in two layers. There are two layers of the muscles, and ventricular muscles are arranged in three layers. And then there are specialized muscles. They are also muscle fibers, muscle cells, but they are specialized in excitatory and conduction properties. We will see the excitatory property and conductivity of the property of the whole of the myocardium. This is, but these myocardium, these muscle fibers, they are special for the generation of action potential and conduction of action potential special. All this is the myocardium. All this is the myocardium special. Now this is the arrangement of the valves. When we are looking, this is the posterior side, this is the anterior side, and we have cut the atria and the cutlery, and these are two visible AV valves. There are two atria, and there is fibrous layer through which the two valves are located. They are the AV valve, left AV valve, which is known as mitral valve, and right AV valve, which is known as the tricuspid valve. And then there are three aorta, base of the aorta, there is a valve which is known as pulmonary valve, and the base of the aorta there is a valve which is known as aortic valve. Pulmonary valve and aortic valve. And this is the muscles, ventricular muscle, like this. Ventricular muscle is very thick, and atrial muscle is thin, much thinner than the ventricular muscle, and the result of this we will see when we discuss the spread of the action potential in the ventricular muscle. हम आगे देखेंगे. And the force generated by the right ventricle and left ventricle is drastically different. That is, this is very powerful muscle, and this is a weaker muscle as compared to. So this is the myocardium. Now we are coming to that, the actual topic, that is the special properties of the cardiac muscle. Muscle, it is a muscle. It is but it has got some special properties of this muscle we are going to talk about. First property is atomicity. Smooth muscles, skeletal muscle, they can contract. There are actin and myosin filaments and a contractile element muscle, but they will respond to a stimulus, nervous stimulus. But the cardiac muscle, they can generate their own action potential. Because of this property is known as atomicity. They are automatic. They don't need any nerve impulse. If you cut all the nerve, sympathetic and parasympathetic nerve to the heart, it will continue to function, because action potential or nerve impulse, the cardiac impulse is generated spontaneously, automatically in the heart, in SA node or AV node or ventricular muscle. It can be generated anywhere. Whole of the myocardium is automatic. So atomicity is special properties of the cardiac muscle. We will explain it in next slides, inshallah. Then conductivity, that is impulse generated at one part, it spreads very quickly in the rest of the myocardium. It can conduct the impulse from the origin to the whole of the myocardium within very short period of time, here at 0.3 to 0.5 milliseconds. Very quickly it can spread. For example, SA node generation of action potential takes place. We will discuss in due time. As a note, it will spread within 0.03 seconds in the whole of the atria. 0.03 seconds. So quick. So within milliseconds, whole of the myocardium. So it is a special property of conductivity. Conduction velocity is very fast, and because of this, heart has got another property. The ventricular muscle, they act as one unit very quickly. Whole of the myocardium are ventricle, they are depolarized and they contract as one unit. Atria as well, they contract as one unit. We call them as functional syncytia. Atrial syncytium and ventricular syncytium. Then excitability. This is excitable tissue. All the muscles are excitable. So this is also excitable tissue, that is get excited in response to impulse. Impulse generated locally or impulse coming through the nerves or mechanical impulse or chemical impulse, it can be excited, and excitation is in the form of depolarization, as you know. Then the contractility, it is a muscle. So all the muscles are contractile. So this cardiac muscle is also contractile, but this contractility differs from the skeletal muscle and smooth muscle contraction. We will see it. So ability to contract in response to impulse and force generation, which pushes the blood into the pulmonary artery or into the aorta, and the circulation is made possible. So this force generation because of the contraction of the heart is the property of the mass. Then another very important property of the cardiac muscle, special property of the cardiac muscle, is rhythmicity. Rhythm means something repeated at regular intervals. Music में rhythm होता है. That is, something is repeated at regular interval. So rhythmicity, generation of electrical impulse at regular interval and mechanical events taking place at regular interval. So this property we will explain it. So rhythmicity. Then sixth property is the functional syncytium. Because of this quick conductivity, the heart acts as one unit. There are two syncytia, atrial syncytium and the ventricular syncytium. So these are six important properties. इसको हम पहले explain करते हैं, and rest of the property we will explain. So functional syncytium, that is, heart acts one unit, atrial unit and ventricular unit. Atrial syncytium and ventricular syncytium. What is syncytium? As you know, syncytium is the mass of protoplasm. Several cells, they join together, cell membrane, they are disrupted or they dissolve, and a mass of protoplasm, cytoplasm in which the nuclei are scattered. It is a syncytium. Syncytiotrophoblasts of trophoblastic syncytium placenta में आपने पढ़ा होगा. There are cell membranes in the between the muscle fibers, but they act as if there is no cell membrane. They act as functional syncytium, not the anatomical syncytium. It is functional because of this very quick conductivity. उसको हम explain करने जा रहे हैं. Functional syncytium, muscle fiber are branching, and they are skeletal muscle fiber, they are not branching. Smooth muscle fiber, they are not branching. These muscle fibers are branching and they are joining together. And there are special gap junction, intercalated discs between the adjacent muscle fibers. What is that? Cell membrane, they fuse together, desmosomes. That is, there are the junctions between, adhesion between the cells. But especially if there is the communicating junctions, gap junctions between the adjacent muscle fibers, very quick transfer of the ion can take place as if membrane doesn't exist. These are the so wide gap junction that the ionic transfer takes place within no time, very quickly. So because of this, the action potential spreads in whole of the muscles very quickly, and it acts as one unit. It is syncytium. So form communicating junction or gap junctions and allow rapid diffusion of ions, and action potential spreads in whole of the muscle very rapidly, and it acts as one unit. This is because this is the functional syncytium. It is depolarized as a whole within 0.03 millisecond. Atria, ventricle भी इसी तरह बहुत quickly depolarize, so they will be contracting as one unit. Desmosome, they are joining together. The cells are so joined, adhere together, that is, the they contract as one unit as well. So atrial and ventricular syncytia, there are two separate syncytia we are going to see. This is the diagram of the skeletal muscle. The skeletal muscle fiber, they are branching. Central nucleus anatomy आपने पढ़ी होगी. Central nucleus striated muscles, and they are branching. These branches are joining together, and there are gap junction between. अगली slide में ज़्यादा वादे हो जाएगा. There are gap junction. These are known as the intercalated discs, in which the desmosomes as well as gap junction there. Desmosomes are the adherents, and gap junctions are through which the ionic transfer takes place very quickly. So intercalated disc containing gap junctions and the desmosomes very quickly. And this is the diagram. This is the desmosome where tight junctions and the gap junction, not tight junction. Tight junction तो वो होते हैं जहाँ पे transfer of ion नहीं होती. Adhesion, very close adhesion here, and this acts as one unit, mechanically has one unit. इतने closely joined together है. And this is the electrically one unit. Electrical transfer takes place between this is intercalated disc, and transport of the ions takes place very quickly, and so that is how it is one unit. It acts as one unit. So two separate syncytia, atrial syncytium and ventricular syncytium, and they are separated by, atrial syncytium is separated by the two ventricle, they join together by a fibrous coat, fibrous layer, which is fibrous AV septum, in which valves are located. हमने पिछली वो diagram में देखा था, valves location of the diagram हमने देख ली थी. Valves in that fibrous layer. This is the fibrous septum in which valves are incorporated. उसमें valve, conduction of impulse through this fibrous coat does not take place. Fibrous layer में तो impulse doesn't travel, they don't depolarize, उसमें depolarization नहीं होती. The conduction of impulse through only AV node and AV bundle takes place. AV node है, हम आगे पढ़ेंगे, special conducting system of the heart. Atria से AV node में जाता है, and AV node से through bundle of it spreads into the ventricular muscle, not through this fibrous layer. So the conduction of impulse through the AV node only takes place, and action potential spreads very quickly in the ventricles as well. Atrial में हमने देखा था 0.03 seconds में timing भी बताई थी, and ventricular में ventricular syncytium में when it crosses the AV node पे जरा delay होता है, उसको हम discuss करेंगे at proper time, and when it goes into the ventricle it very quickly spreads in the ventricle as well as one syncytium. So each syncytium acts as one unit, atrial syncytium and ventricular syncytium. So syncytium को this special property we have explained earlier, हमने पहले explain कर लिया. Now excitability, every muscle, every nerve is excited. Nerves and muscles are known as excitable tissues. They respond. Excitability, the heart muscle respond to stimuli. Response to stimulus हो तो उसको कहते हैं excitability, which may be mechanical. The stimulus may be mechanical, may be electrical, may be chemical. यहाँ पे तो self generation of action potential है, electrical stimulus which spreads, and there is depolarization in the form of depolarization. Response is in the form of depolarization and repolarization. But is very special about this depolarization and repolarization in atria. This is last topic जो आज to discuss करेंगे. Special depolarization and special repolarization. It differs from the depolarization and repolarization of the smooth muscles and the skeletal muscles, and even the nerve impulse. उसके action potential differ है. So special type of action potential. These two collectively they comprise what is termed as the action potential, which comprises of depolarization and repolarization. So this action potential is special in cardiac muscles. What is special? एक दो feature लिखे हुए देखते हैं, then we will see the diagram. That is magnitude of this, total magnitude, resting membrane potential to positivity side depolarization. Total magnitude is about 100 millivolts, 105 millivolts. Resting membrane potential in ventricular muscle is about -85 millivolts, and it can go to +20 when it is depolarized. So magnitude is about 100 millivolts or 105 millivolts. Where this is special again. Action potential in cardiac muscle is long action potential. In nerves, in skeletal muscles, in smooth muscle, very short duration of action potential. Total duration is in milliseconds. But here we say it is in 0.2 seconds in ventricular muscle. 0.2 seconds, not millisecond, 0.2 seconds, 1/5 of a second. So prolonged long action potential because of sustained depolarization. It remains depolarized for quite long time. This is special about the cardiac muscle action potential. इसको हम आगे देखेंगे, explain करेंगे. So there is a plateau in graph that is sustained depolarization. Depolarization okay फौरन वापस नहीं आती. It remains there at depolarized and then repolarization occurs. So this is the area where sustained depolarization is in the form of plateau in that graph. There are fast sodium channels like in skeletal muscle, in nerve membrane, or even smooth muscles. Skeletal muscle and nerve, especially fast sodium channels, are responsible for initial depolarization going to 105 here in the cardiac muscle. So there are fast sodium channels, but there are special channels in the cardiac muscle which are slow sodium calcium channels. They open late and they remain open for quite long time, and sodium and calcium, they continue to go in and they maintain this plateau, they maintain the depolarization for quite long time, 0.2 seconds. So because of this slow sodium calcium channel, but sodium also goes. So slow sodium calcium channel is responsible for this plateau, for sustained depolarization, for long action potential, all that. This is special in cardiac muscle. So this another property, another very important aspect. This sustained depolarization, this depolarization decreases the permeability to potassium, which is responsible for repolarization. It decreases the permeability. It doesn't allow the potassium to leave and to start the depolarization. So permeability is reduced by this action, this plateau, and after onset of the action potential for quite some time because of this, and depolarization starts late. So sustained depolarization. अब हम diagram देखते हैं. This is action potential in skeletal muscle, not this one, this one. Action potential in B. Action potential, that is acetylcholine gated channel खुलते हैं, then voltage gated channel पे और channel खुलते हैं, fast sodium channel, and then the repolarization occur by potassium channel. This is action potential in milliseconds. This is milliseconds, 30 and 0.1 15 millisecond में complete हो गए अगर हम डायग्राम को मोटा मोटा भी देखें. But this is action potential in smooth muscle. Very quick depolarization and repolarization is quick. There is not plateau here. Now we will see the plateau. These are the action potential graphs of the cardiac muscle. This is the Purkinje fiber. This is special conducting system fibers. हम आगे discuss करेंगे special conducting system of the heart में. They are muscle fiber, but they are excitable. They are conducting fibers हैं वो. Contractile fiber नहीं है. Purkinje fiber. So there depolarization and sustained depolarization, plateau, and then repolarization. Ventricular muscle, depolarization, sustained depolarization because of the slow sodium and calcium channel, and then there is the repolarization in the ventricular muscles. So there is plateau. Now we will explain this in a diagram, another diagram. This is the another wide diagram of the same. That is the action potential in cardiac muscle, in Purkinje fiber and most of the cardiac muscle. This initial part of depolarization is because of the fast sodium channels, and this sustained depolarization थोड़ा सा नीचे आ गया है, okay, but it is still very depolarized. Sustained depolarization is the calcium channels, sodium and calcium channel. They open late. ये शुरू में ओपन करें and then they open late here. यहाँ पे कहीं ओपन करते हैं and they remain open for quite long time, and they don't allow the potassium out, decrease permeability for potassium, and sustain depolarization, and after quite long time, 250 milliseconds. Total कितना duration लग गया? 250 milliseconds, 0.2 seconds. So this remains there depolarized for quite long time, and then the repolarization occurs. This is the action potential in special cardiac muscles, and this is again the diagram of the same action potential here. These are the phases of the initial impulse occurs, and the voltage gated channel, fast sodium channel at -70 millivolts, open here, and then the depolarization occurs very quickly, second phase, and then the fourth phase is the plateau, and then the fifth one is the that one. It is also showing another graph. This red graph, red curve, shows the contraction, mechanical event. That is during depolarization. When it is depolarized, contraction will occur. When it is repolarized, relaxation will occur. So the cardiac muscle contraction and relaxation is also recorded in this graph. So these are the special properties of cardiac muscle. Rest of the properties we will discuss inshallah in next lecture. Next lecture को हम discuss करेंगे. Next video में we will talk about rest of the cardiac muscle properties. Hope you will understand it. एंड ये तो हम नया शुरू कर रहे हैं मैंने एंडोक्राइनोलॉजी के कुछ लेक्चर तो मैंने लोड कर दिए हैं. ये फर्स्ट ईयर हमारे यहाँ के जो फर्स्ट ईयर MBBS या फर्स्ट ईयर BDS के जो स्टूडेंट्स हैं उनके लिए ये कोर्स होता है. उसमें सर्कुलेशन जब पढ़ाई जाती है, सो कार्डियक मसल की हम शुरू कर रहे हैं. वी विल कंटिन्यू दिस इंशाल्लाह इन नेक्स्ट लेक्चर. होप यू विल अंडरस्टैंड इट. इफ यू डोंट अंडरस्टैंड यू कैन आस्क द क्वेश्चन इन दिस comment section. I will answer the question. And please subscribe my इसको सब्सक्राइब भी करें मेरे पेज को, और रेस्ट ऑफ द स्टूडेंट्स को आप इसको शेयर भी करें. ये सदका जारिया होगा मेरी तरफ से भी और आपकी तरफ से भी. जितने लोगों को फ़ायदा हो सके हमारी वजह से, तो हमारा सदका जारिया होगा. तो इसको मेरे पेज का नाम फिर साइंस ऑफ लाइफ विद डॉक्टर मोहम्मद यूसुफ. साइंस ऑफ लाइफ डॉक्टर मोहम्मद यूसुफ मेरे पेज का नाम है. होप यू विल अंडरस्टैंड. इसको सब्सक्राइब करें और लोगों के साथ शेयर करें. थैंक यू वेरी मच.